Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, as COVID-19 cases continue to soar, a hospitals group calls the situation in the ground a nightmare. How are the health facilities in Metro Manila coping 10 days after the region was put back under the Enhanced Community Quarantine, or ECQ? Also, the government vows to increase bed capacity in isolation facilities and recruit more healthcare workers. But are these reinforcements enough to address the surge? Philippine Hospital Association President Dr. Jaime Almora joins us live. And later, this story from the front lines. A doctor converts a car into a makeshift isolation room for a 66-year-old woman with COVID-19. Dr. Jaime Almora will also be with us in the program. Hospitals in Metro Manila are forced to deal with what can be described as a doomsday scenario brought by a deluge of patients seeking treatment. The Philippine Hospital Association calls the situation a nightmare, noting the long lines in emergency rooms, overworked medical staff, medical supplies running low, and dying patients who could not get immediate treatment. The government deploys healthcare workers from Cebu Province and Eastern Visayas to augment the Metro Manila hospital staff needs. They are also scrambling to increase bed capacity in COVID-19 isolation facilities to address the overflowing number of patients in hospitals. Let's go straight to the source of the story. We have Philippine Hospital Association President Dr. Jaime Almora. Dr. Almora, welcome to The Source, and thank you for your time.
Thank you. Good morning, Pinky. Good morning to our listeners.
Kamusta na po kayo?
Ito po, maraming tumatawag, maraming nag-express ng mga problema nila ng mga membro ng Philippine Hospital Association.
Please tell us their concerns.
Yan po, ang concerns po nila, as usual, ang nirereklamo nila ay yung mababang manpower, palit ng manpower, at saka yung mga COVID claims for reimbursement na hindi pa nababayaran.
Hospitals are full, Doctor. Ano po? Yung 10 days. I want to backtrack a little bit kasi puno pa rin po ang mga ospital. We are 10 days into the enhanced community quarantine. Government is taking steps by asking hospitals, increase your bed capacity. 50 health workers, around 50 health workers arrived from the Visayas yesterday. Can you just tell us first, is the situation in the hospitals getting any better now than what it was a few days ago? Or a week ago? Or has it gotten worse?
Dalawa ang membership. There are two membership of the Philippine Hospital Association, the government hospitals and the private hospitals. The government hospitals are receiving all the support from the government, but basically, practically no support to the private hospitals. So whatever increase in the manpower from the Visayas that has been brought to Manila will be for the government hospitals. And for the government hospital has a better manpower situation. The private hospitals, their manpower, especially the nurses, are being decimated. So that is the situation, Pinky.
Bakit po mas nagkakaroon ng support for the government hospitals at parang tila nakakalimutan yung suporta para sa mga private hospitals?
I'm really wondering, Pinky, because the government's supposed to, it's a government for the people, so everybody. But it seems there is a policy that the government cannot provide support to the private hospital or to private organizations. COA yata yan, o ano? So whatever money, it should not be given to private organizations. Mayroong problema noon, di ba, sa Congress about the past administrations. Yung tinutulungan nila ang private organization na may problema yata sa pera. So something like that. So it's a government for the government and private for the private. That's how I feel.
Pero because you said that your association involves both private and public hospitals, I want to go back to my earlier question. After 10 days of ECQ, after additional beds in Quezon Institute, 50 healthcare workers coming in from the Visayas, in general, what is the situation now in hospitals? Has it gotten at least even a bit better? Or pareho pa rin ba? Or has it gotten worse?
Like I said, so in the private hospitals, the situation for the manpower shortage is getting worse. The government hospital is better off. They have more manpower, but 60% of the membership of the Philippine Hospital Association is from the private sector and 40% from the government. So mas malaki pa rin yung share ng private hospitals sa health services in this country.
So, meron po kasing dinagdag, no, Doctor, na 110 beds sa Quezon Institute. There was a ceremonial opening 2 days ago. I know that equipment still needs to be put in there. I don't know kung operational na siya today. Again, I'll repeat, there were 50 healthcare workers who arrived from the Visayas yesterday. For now, would these help decongest the hospitals? Or gaano ho kaya kalaking tulong itong nakikita nating improvements from the government?
It will certainly be of help, Pinky. Whatever increase in the manpower from the provinces would be a big help. But the sheer number of cases is so much that maybe the number of reinforcement coming from the provinces may not be still enough. But it will help. It will help a lot.
Gaano ho ba kadaming kailangan nating healthcare workers? Because it might be a difficult question for you to answer, but in your opinion and your view, at least dun sa in your group, how much reinforcement do you need? Kasi ang dami na ho kasing mga healthcare workers na nagpa-COVID positive na rin ngayon. And if that happens, they need to rest, isolate, and be treated for 14 days.
I cannot quantify, Pinky. Maybe the Department of Health would have a better data on that. I'm sorry, I cannot really give a quantified answer to that.
Doctor, then let me ask you this. How do you feel that, we see photos, videos outside hospitals? Sa labas po, ang emergency room po, puno. May mga tents na po sa labas ng mga ospital, puno. May mga the ambulances are lined up para lang po to take them in doon sa ER. Have you ever seen anything close to this situation we are seeing right now?
The problem is complex, Pinky. The patients are being referred to these identified COVID centers from the smaller level hospitals. The natural tendency of hospitals when there is an epidemic is to expand their capabilities. But the situation in the private hospitals, mostly the smaller hospitals, and even in the smaller government hospitals, is that they cannot expand anymore their services. So what they do is to refer their patients to the higher hospitals. Now, there's many reasons for that, and one reason is the lack of incentive because all COVID claims were not paid since the start of the pandemic. But we brought this up already to the attention of the PhilHealth. We had a meeting last April 5. We met with the President and CEO, Dan Tigiran, and he was receptive and very accommodating. And we could feel his sincere sympathy to what is happening. So he ordered the regional offices to pay the COVID claims. So we hope we'll soon receive the payment because, like I said, the natural tendency is to expand. You have to buy your logistics, ventilators, oxygen, more oxygen tanks, physical construction of physical facilities, and if you do not have the money to do that, then you do not, you don't feel like doing it. So the DOH should look into this problem.
Opo.
But we hope we will have the solution soon because we can feel that there is a sincere effort in the part of the president to feel help to take into this, to look into this matter and solve it.
Dr. Almora, doon po sa inyong mga miyembro sa inyong grupo, you're saying that since last year, since the pandemic started last year, hindi po sila nababayaran ng PhilHealth?
Opo. Yes. For so many reasons, it's a difficult situation because the evaluators in PhilHealth would have to, base their payment on some form of guidelines or parameters. And we all know that the COVID case is, it's the first time we have it. We started out without really knowing what is the pathophysiology. And if you can recall back, Pinky, when we started with this pandemic, we did not even have an RT-PCR test. We have to send to Australia. And then we have only one RT-PCR test. And for what seemed like an eternity, we have that only one RT-PCR test in the IRTM. And we have been waiting excruciatingly for a long time for the results. And so we were forced to manage COVID cases based on history of travel and symptoms. And it was accepted then that just by those parameters, history of travel and symptoms, you can already start managing them as COVID cases. That was acceptable then. We don't know the pathophysiology. But as we go on, we evolve. We slowly
understood.
Understood the pathophysiology and adapt whatever was suggested. But then there is no strict guideline. So the claims are being denied due to not in compliance with standard of care or
Doctor, so, but let me ask you this. Kung mag-claim naman ho kayo, hindi ho ba? Tapos ilagay yung treatment is for COVID, does that mean that there's still that still could be questionable, especially now?
Yes, there are many, there are differences in the mind of the evaluators and in the mind of the doctors. The way the doctors diagnose and treat seems to be not acceptable to the evaluators because, they have some rigid requirements, but which is not applicable to COVID because COVID is COVID, we have an evolving understanding and treatment. So we cannot apply rigid rules on COVID management.
All right. Dr. Jaime Almora, we need to take a very short break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. Our guest today, Philippine Hospital Association President Dr. Jaime Almora. Dr. Almora, please describe to us how would you describe, or even your members in the association, the situation in the hospitals right now.
Come again, Pinky. The situation in the hospital by?
Opo. How would you describe the situation we are in right now?
Right now, okay. Like what has been, the scene of what has been being described by people trying to go to the hospital, a long line of patients waiting for their chance to be admitted in the hospital. They are waiting in their ambulances, in their car. There was even one who was waiting in their car, perhaps because there is an air conditioning in the car. And in stretchers. They are just waiting for their chance to be admitted because these are patients referred from lower level hospitals, perhaps from the provinces or from the outlying areas to the COVID centers, the bigger hospitals. So that is the situation in the COVID identified hospitals. In the smaller hospitals, they have more of the non-COVID patients. There are COVID patients going to them being diagnosed, but because of lack of manpower, they have to refer to the higher hospitals, or they would, if they are just asymptomatic or mild cases, they will just send them home to be isolated or refer them back to the barangay health stations, the local government stations.
There was an interview kasi, Doctor, earlier that you said that we're not losing against COVID-19. Ang sabi niyo po, we already lost.
Yes. When a hospital puts a sign that they are already full and they're not admitting patients, that is an indication that they have been overwhelmed, that the disease, that the cases, the enemies have the upper hand. And I thought that the hospitals already cannot efficiently and effectively attend to the patients in a manner that should be an ideal situation. And so I realized that the battlefront is not anymore in the hospital. What we need to do now is to bring the battlefront to the doorsteps of every household, every office, every workplace, because we need people now to defend themselves, to make sure that they will not get sick, because if they get sick, they cannot expect that they will be accommodated right away in the hospitals. So it is more to emphasize that the people should really be more serious, to be more responsible, and to take matters into their hand to avoid getting sick. Because if they get sick, then the hospitals cannot or will not be able to provide the kind of health care that they would like. So I have thought of instead to bring out the idea of increasing detection rate. And this can be done. But the detection rate, if you have the high detection rate, we can possibly lower down the reproductive rate. So if we empower the people to do the examination on themselves, to be able to self-determine their status, COVID status, then the self-information that they have on their COVID status can be used by them to know how to isolate or to prevent the disease from spreading. We now have the rapid antigen test available, although FDA has not yet approved the commercial distribution of rapid antigen test, but it is proven effective. It has a high sensitivity rate. So if only the FDA would approve commercial distribution so that people can buy them, like buying pregnancy test, because it is as easy as doing a pregnancy test, and people will be taught how to do self-collection of a specimen, and DOH would facilitate that, because it is easy to teach the people. Just show them the anatomy and they would know how to do it, because actually it is a better way to do collection. Now, the reason why the rapid antigen test or the RT-PCR test is expensive is because of the cost of the PPE and the cost of the manpower that performs those examinations. But if you remove the cost of the PPE and the cost of those people doing the examination from the equation, then the cost of the kit alone should be affordable to the people. So I have been doing this, I have been advocating this, and before anybody could challenge the idea of self-collection, they should first try it on themselves and find out what I am saying is doable. Because it is actually the better way to do it. The one to perform the self-collection and perform the examination, the test.
Yeah. Here's the thing, though, Dr. Almora. Antigen tests, the nasal antigen tests, that can be bought. It's actually being sold. In fact, some people really do it on their own. But I guess what you're trying to say is we need more information dissemination. It's as if we need a telemedicine, a hotline we can call, and a doctor to be the one to answer, kasi nga telemedicine, at the other end of the line, and tell the doctor, here are my symptoms. Itong nararamdaman ko. Itong history ko the past 5 days. Anong dapat kong gawin ngayon? I think that would be very important if we're able to do that. I do know there are private hospitals offering that, but some cannot afford the packages being offered to the public.
Yes, Piggy. That's why I am advocating the use of self collection of the specimen and performance of the test by the patients themselves, because we first start with the detection. If you call a doctor in the teleconference to tell him your symptoms, the first thing he would like to know is whether you are the high possibility that you have COVID is only through performance of a test. And the rapid antigen test has a high sensitivity rate,
Yes.
although it's not confirmatory. The RT-PCR is still the one for confirmatory test, but fairly reliable. The rapid antigen test is fairly reliable, so that will help the doctor. So he could direct the patient to do the self-swab on himself, and then with the result, he could call the doctor. This is my result, and the doctor could give a better advice to the patient.
And I wish that would be available and that would be free. Maraming salamat po, Dr. Jaime Almora, for your time. Later, we're going to speak to a doctor who had to treat a COVID-19 patient, not in a room, but inside a car. We'll be right back. Please stay tuned.